Actually, only have one action item, we're gonna take that off. Oh, wastewater fee increase.
So
We're
we're on then.
We're on now.
We're on.
So it looks like we're, go ahead.
Right, I'm gonna call the Flathead City County Board of Health meeting for April 22nd, 2021 to order. We've had some technical difficulties. This meeting is starting at 3:17 p.m. So we will get underway. With that, I'd like a roll call for attendance, please.
All right. Larson,
Here.
Lukacek,
Here.
Berg, here, Malberg,
Here.
Waterman,
Here.
Holmquist,
Here,
Ibauer,
Here.
Noble, and Skeens.
All right, thank you. With that, the next item on our agenda is agenda. Are there any modifications or changes to the agenda?
Mr. Chair, I'd like to remove item number 6, remove memorandum of understanding from the agenda, and I believe Joe can share.
I'll talk to it in my health officer's report. There's a reason why it's been moved.
All right, and I guess so moved. Is there a second to the motion to remove?
Second.
Okay, it's been moved and seconded to remove. Item number 6, the memorandum of understanding for the termination of the CHC. All those in favor say aye.
Aye.
Any abstain? Motion is unanimous. All right, we're on to citizen comment, public comment. As noted on the agenda, the written public comment was uploaded to everyone this morning. With that, I guess there are people, we'll start with the people in the hallway, the foyer. Hi, if you could just give us your name and address before you start.
Sure. My name is Rebecca Norton. I live at 530 Scott Avenue in Whitefish. And I'm here as a private citizen, healthcare professional, and just to disclose, I'm also on the Whitefish City Council, but I'm not speaking in that capacity today. I'm coming to you because I'm a long hauler, which we didn't even have a name for a long time, but I got sick. I'm a hand therapist, a certified hand therapist. There's about 7,000 of us in the world, so we're highly specialized. I've had my own practice for 18 years. And I run it and I treat. And so in March, I started to have numerous exposures, about 6 within 2 weeks. And I couldn't quite figure out why I didn't get sick when I looked back on it, but I think I first was exposed in January because I read through my journal and I had a pounding headache, closed my practice, thought it was the flu. But then what happened in March was someone's spouse was hospitalized with 103.4 temp double pneumonia, and they spent the night at the bedside indirectly to my office where I treat them right across for an hour and didn't disclose it for about 35 minutes. And so I also in that period had people go to Seattle know they were in the epicenter coming to my clinic. Another person was on a cruise, mentioned that it was the same cruise line that had been quarantined. And another person had spent a lot of time in a hospital tending to a relative in Seattle. So I closed my practice on March 13th. And I went into, started feeling kind of bad on Sunday, but I thought it would be respiratory. Mostly it was my gut. But I went in on that following Tuesday, the 17th, and they just told me to quarantine. They withheld testing Medical only have 3 tests available for 35,000 patients. So I did what I was told. I closed everything down. Then we went into shut-in. And then about a month after my exposure, I ended up waking up severely dizzy with vertigo, and I couldn't walk. I kept bumping into things, falling down, and it infected my brain. And so I have a strong rehab background, and I also have worked on traumatic brain injury since 1997. So I've been very involved in neuro rehab. So I wasn't really worried about it because at that point people said we would get over it in 2 weeks. But I made a deal that I would go back to work when I had 2 weeks of no symptoms because I didn't want to expose my patients, and I just always have never treated anybody while I was sick, and that still has not occurred. So now I have not opened my practice back up. I don't know if I'll be able to because I still have a lot of neuro symptoms. My eyes changed. I had over 60 symptoms at one point when I started to look at the long haul symptom logs, and they still keep coming. After my second Moderna shot, I had swelling in my lymph nodes, hives all over my arms. So it's a weird, crazy disease, but I want to tell you, it is real. And even with people like me who are highly skilled in treating neuro issues, I've even treated chronic fatigue syndrome quite a bit. COPD patients I've treated quite a bit. This is just a whole different kind of disease. You never know what's going to happen in your body from one day to the next, and you have to manage your energy levels. So the reason why I came today is I'd really like us to start some type of local support for long haul patients. And I go to Glacier Medical. They've been very nice, but not really helpful at all. And they even say, last time I went, I said, isn't there anybody in the valley that treats long COVID? And my doctor said, no, and even if they did, you probably know more than they do, which is not comforting. You want your doctors to know more than you do because they're doctors, but that's how this disease is right now. It's exciting to follow. It's really, I think we're making good progress, but I think what's going to happen is by the time the research ends up, we're going to end up with really high amounts of people that have long-standing effects of the disease, especially since we have so much community spread here and so much denial about the seriousness of this disease. And so I don't know as a health board if you can initiate a program for people. This week there's a patient advocacy effort. There's national funding coming through. We finally have a real name. But I do think it's going to be a strong need because so many of the symptoms are very subtle. And if you don't have the jargon for neuro or other medical conditions, people don't know that it's actually affecting their organs. And it can really be debilitating. Like I have no idea I wouldn't be working after a year. So I thank you very much for your persistence in trying to control this epidemic, and I'm hoping it won't go further. But I am pretty worried about people not being followed with a clear understanding of the need for early intervention to stop organ damage. So like a new statistic I read this morning was that 70% of long COVID patients have eye issues. And I did. Mine resolved after 6 months. But we should be catching that before people get glaucoma and retinal damage. We should be screening for that stuff now. We should be setting up programs for all the organs to be screened. And even when people are getting their normal screening tests done, it's not at the microscopic level that COVID destroys our bodies at. And so that will be changing, I think. but it's scary to look at and think of all the people that we have had infected in the valley now that we have such wide community spread and so much disinformation about how to stop the spread. I think it's going to be a really big emergency at some point, especially if the mutations continue and they affect children. Luckily, their immunity is strong, but it's happening. So I just wanted to put that on your table if I could, just to remember that there are people out here that are managing our own care, and we have been for well over a year. And even if you've worked in medicine for over 3 decades and have a good strong background in how to deal with health issues, it's still really hard to feel like there's no support, if not intentional disregard for us about the long-term effects of COVID. So thank you.
Thank you, Mrs. Martin.
Hello, my name is Tony Oberts, and I live at 255 Echo Chalet in Bigfork, Montana. It is on the Flathead County side. I'm here to tell you 3 stories and ask you to consider 3 questions. So my first story relates to an invoice or a statement that I sent almost all of you. And that is when I got sick with COVID in November, I lost a significant amount of revenue to my small business as a result. How I discovered that I had COVID is that I fainted on a client call. Can you imagine what that was like for the client? New client, and I just literally fell off the screen. They didn't know if they saw me die. They didn't know if I just fainted. They couldn't call 911 because they were located out of state. There was no way for them to help me. That was scary for them, as you can imagine, and has of course affected our relationships moving forward in the consulting I do with them. However, it didn't end there. After I completed the course of COVID, I continued to be dizzy on Zoom calls. I have been in physical therapy for 2 months. I took 2 months of physical therapy, and I continue to be dizzy on those calls. And certainly I worry about fainting again because I do not want another client to go through that experience. There are both economic and health effects from having COVID. So would you consider the effect that the spread of COVID and those who are not getting any vaccinations will continue to cause in our valley? So that's question number 1. Story number 2 is this. There has been a study that has been ricocheting across the internet on social media in the last month, and it's related to masking. And it would seem like this research study is legitimate because it's from Stanford. Of course, we trust a legitimate source like that. However, from 2 simple phone calls, we discovered that the gentleman who wrote the research study, 1, did not work for Stanford, was not a part of any research study, and 2, he had said that he worked for Veterans Affairs for Palo Alto. So we, in looking at that initial study, thought, oh, this must be legit because of those 2 elements, but he just made it up. How much other information in that study had he made up? Probably most of it. And so as you are looking through all of the information and all of the sources that you have to review, I ask to consider what is the legitimacy and what is the credibility of the sources. Third story, that is a few years ago, Facebook released the results of different foreign actors that have in our elections put out various different memes and posts. And they could be traced back to the same individuals who posted memes that were diametrically opposed to each other. Why? Simply to cause chaos, simply to cause misinformation. And unfortunately, we are in a media environment where there are nefarious actors who will take any type of controversy, and any type of controversy, they want to ensure that they cause that confusion. So as you consider the sources that may be presented, is there any nefarious reasons why that information is going to be presented? And so those three questions that I have for you are, what are the long-term economic and health effects for those who do get COVID? What are the credibility of the sources of information that is presented? And then third, is there any nefarious reasons why those sources might be presented? And that could actually harm the Flathead Valley as a result. Thank you.
Thank you.
Thank you.
Good afternoon, my name is Sherilyn DeVries. I am here on behalf of Love Lives Here, and that's at PO Box 204 in Whitefish. And I am here to thank you all for all of the amazing work that you have done during COVID. I know it's been an extremely trying time, and to see how many times you guys have made sure that the well-being of the community was centered in all of the discussions and the decisions that you made. Even as attacks were coming from anti-mask and anti-COVID forces. I volunteered a couple times at the immunization clinic, and I was so impressed with everything that happened there. The kindness of all of the professionals and the volunteers, how smooth everything ran. And all of the people, well, not all, most of the people who I talked to made some comment about like, oh, this is so great. This is so wonderful. And what was hilarious is one person even said, you know, this is running so smooth, the government should work like this. And I said, you know what? This is the government. The federal government got you vaccines, and your local government organized all of this so you could waltz in, get your vaccine, and waltz right out. Unfortunately, what's happening is we have anti-mask folks who are promoting misinformation, intentionally disinformation and misinformation, and maybe some of them have firmly held beliefs that they are right. The problem is that what we're seeing is that many of this information and disinformation is coming from anti-government and pro-militia sources, so violent extremism. And we are seeing the effects of this because people at the city level, the school level, county, are all receiving threats. We're in the middle of it right now with school board elections. Anti-mask supporters are making hostile calls to school board members and candidates, and it's dividing the community. And that is what is really unfortunate about what's happening. And so again, what I would like to say is thank you. Thank you for listening to public health professionals. Thank you for really being strong pillars of the community who are genuinely interested in the health and well-being of everyone here. You guys have been an anchor and a really strong foundation for all of us as we've tried to work our way through to the place where we can have vaccines and we can move forward and hopefully get beyond this place that we're in. So thank you for all of your efforts. Thank you.
So, Roger, I think we have some people that may be on the line, and I can call them off. Dr. David Smirno. I did not see someone on the line. Sharon Stratton. I just admitted someone. David, is it Smirno? Sharon Stratton. Tara Lee. You need to unmute yourself.
Yeah, hi, this is Tara Lee. I just would like to reiterate, I agree with what Sherilyn DeVries just noted, so I won't be too long here, but I'm a registered nurse who volunteers at the vaccine clinic at the fairgrounds. And I'd just like to reiterate how amazing that it has been run. The volunteers and health department staff and the nurses who volunteer from the hospital have just done a miraculous job. And it's the best well-oiled machine that I have witnessed in a long, long time in this valley. And so kudos to everyone who has put time and effort into making sure this valley is protected, you know, as good as we can do. And as a nurse who has worked through COVID at the hospital, it's the one place that absolutely fills my soul with some positivity. Every single person has been thankful who we've given those vaccines to, and it gives healthcare workers a whole lot of you know, positive reinforcement that what we're doing and what we believe in is making a change in this community, because we do see a lot of negativity out in the community and even occasionally at work. So anyways, just wanted to reiterate how important all the work that you do is, and thank you for being believers of science and evidence-based practices that behoove our community.
Thank you, Tara Lee, for your comments, and we appreciate your volunteer efforts.
So last one, identified as Thomas Millett. Thomas?
We did receive extensive email from him also, so it is part of the record. All right, I guess that ends our citizen comment. There's no one else in the hallway. All right, thank you. We'll move on to item number 5, approval of the March 18, 2021 board minutes. Are there any corrections, modifications, exemptions to the minutes as provided?
Yeah.
Sure.
Roger, I thought about the minutes, and certainly the format of these minutes have changed quite a bit since I was here. I wonder if the board would like to see a little more substantive text in there. Just not, to me, I know we video, I mean, we have everything is there. Are these good enough? If they're good enough with the video, I'm fine, but if you'd like, I've talked to Janelle a little bit already about maybe adding a little bit of, maybe if there have been comments made that should be put on the record.
Yeah, I think that's a real valid suggestion. I'm on the board of adjustments too, and our meeting is also videoed, but the minutes provide a summary, albeit succinct, but it is on a discussion of what happened and who spoke. And so I think that'd be worthwhile. This format doesn't really allow you to give much comment.
So I'm sorry, Janelle, a little bit more work for you. We're not gonna, they're not gonna be verbatim.
No, I don't expect.
There may just be a little bit more meat around the bone, if you don't mind.
Because that was the problem. We went kind of from one extreme to the other. The other extreme had a lot of inaccuracies in it.
That's true for the Goldilocks effect. Not too much, not too little.
Yeah,
Right.
I'll be looking for that clear statement.
All right.
We'll try to put a little more.
Sounds good.
We maybe put a timestamp next to that, because I know it gives the amount of time, but you have to still like go through. So we had like a timestamp which you could start it at, like, so it has a summation of the minutes and seconds, and then you just like timestamp it at like whatever. Then people would know that they could fast forward if they were interested in that topic.
And, Janelle, it might be better if you just have a seat in here, since this is all going to impact you. That's just super funny today.
You don't want to repeat what we all said.
Thanks, Janelle. Thanks, Roger.
Yeah. All right, so with that, is there a motion to accept or amend the minutes as provided?
I'll make a motion to accept the amendment or to make the change.
We're passing these, right?
Yeah.
Yes, we're
The
passing
motion is
these,
passing
yeah.
these, yeah.
We're just making a recommendation. to
Yep,
revise-
okay, then I
revise
just make a
it.
motion to accept the minutes as written then.
Second.
All right, it's been moved and seconded to accept the minutes from the March 18 board meeting as provided. Any discussion? All those in favor say aye.
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 Any- Thank you. All right, with that, we have, we're on to COVID updates. Joe, do you have a update you want to give us on the committee?
So Roger, I'll actually defer to Pete for any committee. I'll present my slides in my.
I guess I will, and I think Annie wanted to say something, so maybe it's all right, yeah, Annie could say, give her presentation, and then you may make some comments after that. Would that be acceptable?
Sure.
Or I could follow yours. Timing wise, I could just follow.
Yeah.
And there might be more of the same kind of information given.
So mine are basically just on the community stats. I've seen cases, I'm not speaking to any research at all, so mine are literally just factual.
Okay.
So I'm not sure there'd be anything to talk about.
I think Dr. Bukacek will let you go ahead. I kind of want to caveat this a little bit though. Just before. So Dr. Bukacek requested that she be placed on the agenda for this meeting because she wanted to provide some input. And I've kind of subsequently learned that I just found this out yesterday for Tuesday, that it takes 2 board members to make a recommendation to put an item on the agenda.
Okay.
But nevertheless, we're going to move forward with your presentation. But for future reference, if board members want to put an item on the agenda, with that, anybody that speaks relative to this, these are their opinions, and they're solely the presenter's opinions. Dr. Bukacek provided us considerable written information as part of her preliminary address, and that's, I'm sure, part of the record. I'm also going to allow other board members to speak if they want. I want to advise everybody, this is not a debate. It's strictly to provide a discussion and input. And with that, we do have a very full agenda, so I would hope people can limit their comments to 5 minutes. All right, Dr. Bukacek.
Appreciate your kindness and consideration, letting me do this. And I didn't know I was going to be presenting, so this is, anyway, but I wanted the topic presented, so I'll do my best. I'll read the letter that I sent you. This will be brief. It says, are we being responsive to public health needs based on a medical science perspective when we encourage mandated masking for school children? My answer to the question is obviously no. I provide attachments, some resources from which I form my opinion. And I can send plenty more at your request, and I send some additional information. Public health recommendations regarding COVID-19 cannot reasonably be made for masking and vaccines without weighing the risks of those measures. Traditionally, medical decision-making involves weighing risks and benefits of one decision or one path over another. That can include taking action and taking no action, or making one medical decision over another. But it's always been a risk benefit that we would look at, because nothing is 100% risk-free, nothing is 100%, So that's traditionally how we've done it, and it's the only thing that makes sense. So it was readily predictable, the adverse events of lockdown, especially on the elderly. I sent you a letter. My mother is just one example of 7 months without seeing her children, and then she died. These kind of experiences of these elderly people going on throughout the nation. The torment of loneliness from their forced isolation from their family under the guise of protection. Then I asked the question, protection from what? When in the Flathead, there was less than 10% COVID positive tests in our population, despite ardent contact tracing. In the Flathead, we have not been in lockdown since the first cruise Kalispell event, April 17th. So no reasonable person can say that the paucity of COVID so-called cases in the Flathead is from our use of isolation techniques, nor can any reasonable person say the paucity of cases and illness from COVID is because of vaccinations. And this, when I sent this last week, it was only about 15% had the full measure of vaccines. I think 30% had at least one, but in terms of fully vaccinated, it was 15%. We'll be getting an update on that from you, Joe. The adverse health impact from the division in this community over masks and vaccines would evaporate without mandates, and we could restore faith in the health department and board if we promoted the traditional science-based risk-benefit medical decision model. So when they talk about the division in the community, some of the public came in and talked about that. The division, from my perspective, is because of the mandates. It's not, people wouldn't be talking about mask choice, which is not anti-mask, but they wouldn't be talking about mask choice if they had that choice. And in the school system, most of the schools, they do not have that choice. Big Fork, Smith Valley, Marion schools do not have mask mandates, and there's been no outbreaks, to my knowledge, since they did that compared to the other schools. So I think that's important. 0 children in Montana have deaths attributed to COVID-19. I gave you the CDC tables on that. The 16,660 so-called cases of Montana children aged 0 to 9. A case simply means they tested positive. It could be from contact tracing. There, most of them probably were asymptomatic, minimally symptomatic. It doesn't mean the child is sick. The peak of so-called cases correlated with the months of our usual cold and flu season, and you notice mysteriously there were no flu cases. I've had 3 doctors I've heard say, it's proof that masks work that we didn't have any flu cases. That's totally irrational. Regarding the concern that these children will bring illness to their parents and grandparents, death per case of Montanans is 0.038% under the age of 70. That is not statistically significant. It's not clinically significant, certainly. Less than 10% of residents of the Flathead tested positive. There's a 0.0% or 7 in 10,000 of the Flathead population deaths attributed, I put that in quotes, to COVID-19. And again, I talked about the Cruise Kalispell event. We have not been in serious lockdown. PCR testing, I've sent you information about PCR testing before, the evidence that it creates meaningless data with a cycle threshold of 40, so commonly used in Montana. And then I gave you a bunch of references. And what I would ask, if this is appropriate time to ask this, is that we, if we could have if I could make a motion, or whoever can make a motion to stay neutral regarding school masking. There had been a letter from you, Joe, as the health officer, encouraging the schools for masking. I'm wondering if we could take a more neutral stance. And the basis for that mask mandates, there is absolutely no consensus on whether masks work or not. And the preponderance of data and articles, and I sent you a whole bunch of them, say that they are not useful. There are legal ramifications potentially for the masks. It was outlined well by Alan Baker, that mask mandates by government or public agencies, which would be public school boards, violate the Montana Constitution. And these mandates engender distrust of social institutions. So if there came a time when we actually really had a true crisis come to the community, it would be less likely that people would trust us, would believe us. And the other thing is, really in this community, and I think across Montana, the jig is up. I mean, I walked by the senior center when they were kind of closing downstairs today, and the seniors are not wearing masks. I mean, people aren't buying it, okay? I'm not saying everybody, obviously, the people that came in and made public comment are buying into it. A significant percentage are not. And so I would recommend that we stay neutral, you know, at least on that. We're not gonna, not everybody's gonna agree as strongly as I do about this, or have as strong opinion as I do about it. And that's why I would recommend we stay neutral. Real quickly, just give just another minute, I think. I sent you some information from Dr. Rodney Sturman. He has expertise in application of applied statistics, particularly in fields of medicine and public health. He's one of the co-signers of the Great Barrington Declaration, which a lot of you are probably familiar with. And I sent you his own declaration. I also sent you Alan Baker's email because I think it might have gotten lost. And it was very cogent and concise with his arguments. And the studies that had been sent to us, you know, by Joe, they have significant issues. All right. Now, Joe concedes the CDC data on COVID-19 reveals little to no risk to children. The CDC shows very little risk to teachers since vaccines are available to them. Children are not found to be spreaders. Most teachers are under 70 and therefore at low risk for serious illness. Mask effectiveness in the community has not been demonstrated. Something that happens in a lab cannot necessarily, probably does not translate into community or real life. So COVID models, so a lot of the studies that promote masks are based on models. We know that the Neil Ferguson model out of the Imperial College was, you know, fatally flawed, ridiculously flawed. You know, models are problematic in that assumptions are made that lead to results that are simply restatements of assumptions. That's the problem with models. Two more things. No question that mask mandates have adverse physical, emotional, psychological, and social consequences. I stood with the students at the Flathead walkout, and the other students coming out were flipping them off, swearing at them, screaming at them, at the students that had walked out. There's tremendous division, and it's being caused by the mandates. For public health efforts to be successful, there must be mutual trust between health departments and the public. Health departments heeding only one side of the mask controversy, we at a minimum have to agree it's a controversy, giving no credence to the burgeoning information that is contrary. So that affects our credibility. One last one, mask mandates promote fear and division among people, especially when they don't line up with the preponderance of data and science, because people do a lot of their own research. And what one of the people spoke about, that you have to be careful of the various sources, that goes on both sides. I mean, you have to be really careful, but people do their own research, and much of the credible research is what leads people to believe in mask choice. And so that's why I would recommend that we stay neutral on that.
All right, thank you, Dr. Butch.
You're very kind, thank you.
So one item that I can address, this is a non-action item, and so there's no way we can make any motions on this today. With that, if there's any other board members that would like to provide their opinion, I would allow that. If not, we'll just move on.
We're looking at me, so I'll comment. So, I mean, I'm not going to really provide my opinion as much as point people again back towards the citations. Just go to the CDC website, and that will have a very nice summary. In fact, they have, I think, a 28-slide summary that's really user-friendly, that goes through the step-by-step evidence for what the evidence is that supports community mask use. So it's not, you know, I'm not asking you to listen to my quoting of the data. Just I would reference you there, and it not only shows what happens in the lab, and he argued that it's not been reproduced by community studies. The citations there also show epidemiological changes in cases that occurred once mask requirements went into effect, and changes in the slope of the epicurves. So I'll just point people in that direction. without, again, going into the studies. And bias is strong. Bias is really a strong thing. And I think we all can be guilty of bias, and we kind of throw out that these statements of I want to do my own research, or I'm going to quote this study or that study. I think it's more complicated than that, right? In medical school, in public health school, you learn how to read these studies, and not all scientific studies are created equally. And to really look at them and say, this one is well done, and this is what it shows, versus choosing something that is going to conform to preconceived worldview before you even start your literature search. So again, I'm not going to go into all of the, I would point, if you want additional information, I'm not going to get into my studies versus Annie's studies debate right here, but point you back to some of the key studies that the recommendations are based on. Secondly, Annie was arguing that this board should remain neutral on mask use, and we kind of have been. I mean, this board has not done. In fact, I was a proponent of advocating more aggressive measures and to make community mask use more prevalent or a higher standard in our community. And this board has chosen not to do that. So I'm not exactly sure, Amy, what you're asking us to do, because this board has remained rather neutral on that. And the mask mandates that are in place have come either from the governor's office, and they have also come from the individual school boards that have made those decisions. And lastly, I think division is less caused by those of us who are truly trying to make wise decisions for our community. I think divisions are more caused by those who wish to stoke animosity versus those of us who are truly trying to make wise choices and to make policy changes that are going to impact the community in a positive way. So I think that is where the accusation of division should be directed at, is those who are promoting conspiracies that this is a hoax. Those are the ones that are to blame for the divisions.
Thank you. Okay, any other, yeah? Sure.
Just, I know that a lot of this was brought forward because I think in our community right now, there's a lot of this going on because of the schools.
Correct.
And what's going on with the schools. And at the end of the day, we as a health board have no authority over what the schools do. They have that total authority. They're totally autonomous from us. They can do whatever they want. Some of them they're all doing it differently is what I understand. I'm not watching what they're all doing, but I know they're all doing it, trying to accommodate what they can within their schools, because their schools are all different. We all have a different plan, trying to accommodate, trying to keep our kids in class if possible, and giving alternatives to those that don't feel comfortable for whatever reason for coming to, is what I understand is going on. Like I say, I'm not intimately involved. I don't have any kids in school right now, but that's what I understand is going on. So at the end of the day, if there's something going on that somebody's upset about, or maybe they're feeling like they're not being heard, they need to go to the school board and express to them, and that's where it happens. That's where the issue gets brought up, taken care of. We don't weigh into that because we have no authority. We have no reason to be there, and that's why we have stayed neutral. And I think that was wise on our decision, because there's no reason to bring a city county health board into an issue that we have no authority over. So, appreciate the updates, appreciate all that, but I think at the end of the day, I think we need to just stay where we're at. I think we're as a county as a whole for over the last year and a half, I think we've done amazingly well compared to several other counties, not just in Montana, but all over the United States. So I think that's where we're at. I think we're doing a good job. As I've said in the last meetings, I want to get back to all these other things we talk about that are so important to our
Yeah, I
community.
think all of us do.
You know, environmental health, population health, all the stuff that we need to focus on because COVID is waning right now. Hopefully that will continue. We don't know, you know. The numbers went down for whatever reason. You know, there's information out there all over the board. You don't know what, you know. I mean, you can take one study and discount it with another study and it's just all over the board. So I think as individuals, we all need to just make up our own mind. It's good to get information. You know, I've read all the information we've received through these last year and a half. But at the end of the day, I think right now, our focus is to get back to some sort of program with our health department and just stick with that and do what we need to do within our authority and stay out of the other areas and arenas. So that's just my thought.
You know, the health board did appoint the health officer, and the health officer made a strong statement to the schools sometime back. So that's what I was referring to. So we have appointed him. So if he makes a statement, it's as though it's coming from us. It would seem, and it was not neutral. It was very strongly encouraging. Now, the
Okay,
I think
this wasn't gonna be a
okay,
debate.
no debate,
Right,
yeah.
We're done. So
Gotcha.
Pam, are you finished with your
I am
discussion?
finished, yes, thank
Are there
you.
any other board members that would like to
I
have?
would just bring up a point, just
Sure.
that a point was made that children don't spread the disease or that the teachers are under 70, so we don't really worry about them. But many of the people that take care of the children are elderly people because their parents are working. So my parents take care of my niece and nephew a lot, and they're definitely over 70. Well, just turning 70 and over 70, and that's a common situation in many households too. So I think we just need to also have that as part of the record or just as consideration.
And to fit into that, it's not just like, we can't just lump all children from 0 to 18 in the same category. Like the high school kids are, from a COVID standpoint, are going to be closer to, you know, adults as far as their transmissions. And junior high kids are closer to high school kids in that range versus young kids as well. So it's not just a, you know, all children are here. It's a upsloping curve where we know, yes, kids who are middle school and high school, yes, their transmission rates are higher, but it's not just like you go from 6th grade to 7th grade and then all of a sudden you go from a non-transmitter to a transmitter.
Okay, so great discussion on this.
Thank you.
I think we'll move on to the committee reports. Personnel committee. Kyle, do you want to, is this your?
Sure, I mean, just the personnel committee did meet last month. You know, we sort of had a high level conversation just about how staffing was going in general, so that we could understand what was going on sort of with the COVID money, but then also as we're looking at the department, we also have a new the personnel committee board member. So we had a chance just to update sort of where we were, what's happened the last year, where we're going forward. But apart from that, no action was taken. It was really just, again, new board member and making sure that we had a good understanding of how the budget affects our personnel committee and our strategies there.
Okay, so I keep hearing rumors that Joe's gonna be done in December. So
Just have a 1-year contract.
yeah, so I'm just curious if we should start to reconvene the search again.
So, I mean, I guess that is something that personnel committee did have a little bit of that discussion. We are with a health officer that has a 1-year contract. Though we have not been given notice or anything like that, we are looking at what we would do through the year. You know, I can always keep my fingers crossed that Joe will just renew that contract. But I do think that we are, I mean, I do think that there's a chance that what we've known, and that was part of briefing Jessica and making sure that she was up to speed. We did engage a headhunter last year, and we have an extension of being able to reutilize that headhunter within the same year without the startup fees. So that's something to consider, but no action to be taken now. But just sort of making sure that we were aware of all those things as they went into the fiscal year and the new budget. So I can't speak to rumors. And again, I want to see things in writing. I think all of us who have ever managed employees, you want to make sure that things are actually documented, not versus what's in the rumor mill. We do have a 1-year contract, so that's what our decisions can be. And then I think that what the committee might do is we'll continue conversations with Joe and let the board know as we get later into this year. But as far as budgeting, it looks like budgeting wise, we're in a good position for personnel committee.
Joe's picked himself up off the floor and is back in his chair now. So I guess I would encourage you to maybe have this discussion with Joe between now and the next board meeting and bring a decision forward in a time frame, a schedule.
I can summarize what the board, the personnel committee was. We're going to keep looking at what the staffing structures look like. Might take action with health officers search more towards July, August was sort of our timeline of when we were thinking about having. We've had conversations with Joe. That's sort of where we are right now. Was focus on budget, what's happening with the separation of the health center, because that does have a staffing issue and element to it. And then once we've sorted through sort of these things, then we're going to deal with the health officer. Like I say, that'll be a summer project.
Thank you. Any
Yeah,
other-
I have a comment. Hey, Kyle.
Yeah, no problem, Pam.
Hi, how are you? I had
Good.
some conversations with Joe earlier and some others. And actually, the more I thought about it, the county used Andrew, of course, you know, for the county administrator. And we were very successful at that. So he's free now to help us with ours and hopefully have the success that we had. So I'm actually thinking on further thought that we should maybe start in June. And the only reason for that is because when we had our meeting, I was thinking Joe was going to be here till January, but he's not. He's here till the middle of December. So that's a month less than I thought we had. So I don't know. I know we have to have a personnel committee meeting yet to decide that, but I just wanted to throw that out there so we can all be thinking about that.
No, and I'm fine talking about that. I mean, part of it, Pam, and thank you everybody for. Sorry not to be in person to have the conversation, but I do think first we want to make sure that we sort out if there's any staffing that we need to address regarding the health center. Finalizing budget, making sure that we're in a good position there. And yeah, I mean, Pam, I'm fine with if we start talking. The committee will be meeting regarding those items in a couple of times, and then moving to Joe Russell. The advantage is that we have done a lot of this preliminary work with Andrew for a search, so we won't have to do as much salary surveying, rewriting of job descriptions, or those preliminary searches that we have where we're actually sort of a step in. But I'm fine to discuss as we have that personnel committee to discuss the health center, to then talk about if we're looking June, July. But I mean, I think everybody can anticipate that probably, you know, we do have a deadline that by the end of the fall, by the December, we have a contract that might be coming up, and it does look like we'll need to be doing a search.
We have to have the health clinic settled by the end of May, so.
Yeah. So that was sort of our first agenda item that we were going to take, if that takes any personnel committee.
Joe, I don't recall the date that the people have to make their decision. Is it tomorrow?
Yes.
To stay in
Yes.
this?
Yeah.
Okay.
I mean, this is somewhat of a personnel issue, if you don't mind. So all the health center staff have been identified and received a letter,
Mhm.
and they have till the 23rd,
Which is tomorrow.
which is tomorrow, to make basically to state if they want to stay as a health department staff person and move with the health center. So I have received a few. HR and we'll sit down and go through these and see if they fit with a movement as per the bargaining unit agreement. But yeah, tomorrow is pretty much a big day.
You can't release any information, but it's still going as well as expected so far.
You know, can I wait till the health officers report for that?
They're always gonna be.
I'll feel a little more free, 'cause
Yeah.
that's my time.
Let's hope for the best, continue over the best.
Okay. May I ask a question for the personnel committee? Yeah, so my, really appreciated, working with Joe since he's come on board and getting to know him. I guess my question is, and maybe this is premature, but my understanding is that when we were offering some of the positions to health officer, salary was a large stumbling block, especially given the current cost of living in the valley. And is that going to be reconsidered at all when we go round again?
And Pete, you're hitting sort of exactly what the context of what we did talk about. As Pam mentioned, the county has just finished another search and did not run across those stumbling blocks. So we didn't necessarily think that there was something that we need to incorporate into the budget to be able to accommodate for that. So that's just sort of where we were. We will start those conversations again with Andrew and have a couple of those conversations with Tammy as we start up the process. But that was sort of preliminarily why we were having a meeting, was to see, are there any of those things that we might need to consider for the budget personnel wise.
All right, thank you, Kyle.
No problem.
Move on to the Environmental Health Committee report.
Yeah, we met 2 days ago,
Yes.
and we do have something to bring forward, if you don't mind, Roger.
Yeah,
Just kind of, okay, so this isn't working. In your packet, I'm gonna, stop sharing for a sec. So in your packet, there's a memorandum, proposed fee increase, environmental health program. These identified 2 site review, site evaluation fees that we charge. First one's a site review fee. It is a fee which requires our staff to go to every site and make sure that septic systems and wells and houses are going in the right place. This is really critical because if people put something in the wrong place, they'll probably end up sideways with the Sanitation and Subdivisions Act. And so when someone splits a piece of property, every bit of water, sewer, stormwater, solid waste is reviewed. And in every site has to have a site plan of where things are going to go, because the orientation of a drain field, where it's located could have a big impact on surface and ground quality. So if someone elected to just move that, we can be in deep trouble with the Sanitation and Subdivisions Act. So we have this site review fee that we do a bench review. We actually go to the site and make sure that all the sites are staked correctly. We don't do test holes or perk tests or any of that at this thing. This is basically to make sure that what was reviewed through and approved through the Subdivision Act is actually happening on the site. I came through a formula. Staff support time is about 30 minutes. Professional time, 2.5 hours or so, which is site time and bench time. And then the mileage is about $17 for that trip. And that's based on just an average in Flathead County that everything is 15 miles away, that has a septic system. So if everything's 15 miles away, the average is going to be about 30 miles to do that. We don't charge persons like an engineer might, which would say, well, we're going to go to the site, it's going to cost you. We have to lump sum because that's how the government does. So we have the site review fee. I went through all of these calculations, presented to the Environmental Health Committee to set the fee at $150. Total cost of the program, plus a 10% overhead to cover computers and desks that we have to buy and all those things that when you're in private practice, you understand that. But we have those same expenses. So total cost for a site review fee to be set at $150. Site evaluation is typically on land, maybe 20 acres or old parcels or something that's changing drastically, where we literally go out and do almost a subdivision type review. We look at test holes, we might require groundwater monitoring. We look at the lay of the land. There's a lot of things, as artists will tell you, that's at least a 2-tripper for us. So lots of bench time, but at least 2 trips, oftentimes more than 2. We can't charge per trip. It just doesn't work. That would like say, well, we're going to have a set of speed trap here and we're going to see how much money we can make for the city. So we can't literally do that. So we have to set basically an average or nominal, type charge for these. So it takes a lot more time, a lot more effort to do a site evaluation. Almost 4.5 hours when it's the times everything's done. 253 charges 10% overhead, goes to 278, and I suggest we set the fee at 275. That fee right now is 225. Roger, do you have want to add anything else? We can talk about the after the fact, or would you like to do that?
Let's do them all 3 at once.
Okay,
And I
so
guess- go ahead.
after the fact permits, these occur when people neglect to go through the process and literally install a system without a septic system permit. Oftentimes they're non-compliant. We start over and we just say, well, whatever's in the ground stays in the ground. You can't hook to it. We start over. We don't charge an after the fact permit. But if the system literally is compliant and we can issue a permit, we would then charge this. I did some search, talked to the planning office. Their most, one of their after the fact permits is like 4 times the permit fee. And it actually is about $1,250 for an after the fact permit in there. Their permit's about $300 as you can back into that. So we had a lively discussion the other day about this, and my staff wants to put it at 2,500. I think that's unreasonable. Sorry, staff. They do that because they're a pain in the butt when someone gets us in this position. So I think we elected to land on 1,500. I'd be very frank with you. I am not setting this based on time. This is a punitive fee. It is a punitive fee, but that's what after the fact permits really are. Let's face it. So we finally agreed on 1,500. I think, did we?
Yes.
Yep.
I think Pam didn't, but she's only one voice. You're an outlier, but you're only one voice. But the committee decided to move these forward at 1,500. So what we proposed, and it was moved to bring these to the board with a positive approval, that the site review fee would go to 150, site evaluation fee would go to 275, and the permit, or after the fact permit fee would go to 1,500.
Can we approve it today, or is this?
No, it's an action.
An action item for today. And so I guess just to follow up a little bit with what Joe's saying, it had been quite a while since these rates were raised. There has been quite a while since these rates were raised, and just the huge influx of work the health of the environmental crew has. It's an appropriate time to make an adjustment. So it was brought forward with a recommendation from the Environmental Health Subcommittee to change these, as Joe mentioned, to 150, 275, and the after the fact to $1,500. It's more like a.
So it does not need a second because it's coming from a committee.
No, we need to have a motion to move it to, someone needs to make a motion to accept this recommendation fee increase. And a second, and then we'll vote.
The committee chair can do that.
Well, chair doesn't typically make motions, but
I'll make a motion. Make a motion to accept the wastewater fee increase.
motion on the floor. Is there a second to that motion?
It doesn't need it. Correct?
Pardon me?
It's coming from the committee, it doesn't need a second.
It comes as a it comes as a recommendation from the committee now. We do need, it is an action item. So, okay, it's been moved and seconded to accept or approve the proposed fee increases to the environmental health program. Any discussion or any comment?
Just one question I have is, so these fees were not the part of what we changed with wastewater fees last year, is that correct?
No, that was something entirely different.
Okay, so these are totally new fees. Okay. I makes sense. I always appreciate that fees are covering our services when it comes down to environmental health. So I really support the direction that this is going.
Thank you, Kyle. Any further discussion?
As I recall, when we were interviewing candidates, one of the comments was how low our fees were at that time, and it seems like a modest increase.
With that, could we have a roll call vote on this?
Larson,
Yes.
Lukacek,
Yes.
Berg,
Yes?
Malberg,
Yes.
Waterman,
Yes.
Holmquist,
Yes.
Hubbard,
Yes.
Noble.
Yes.
Excuse is absent. Passed unanimously.
All right, thank you. So that takes care of that. We'll move on to department reports. First up is environmental health.
So for some reason, I cannot get any documents up. So you do have the documents in front of you. And just wanted to burn through a few things. Septic system activity, 101 permits received last month. We're on a pace this month to crack that up pretty good. So, you know, when there's no houses on the market, people want to build, and everyone wants to build. So we're screaming busy in environmental health right now. You know, we have a fairly new staff, and they're getting out and they're knocking these reviews and the site evaluations out. Subdivision activity, I think we really didn't touch as deep as we wanted to on this subject, but we are doing a few reviews, and we need to address this as a board at some point very soon. Food and consumer activity, 153 inspections in the food safety realm which is a significant number. And you'll find that these numbers are going up because during COVID, a lot of these folks, we couldn't get into a lot of these places, and we were, even some places in the state were trying to do Zoom type inspections, which in a food safety environment just makes no sense at all. You can't monitor in a casserole, you can't do a food safety inspection. So, you know, we're finally ramping up, everything's open, and things are going really well. I meet with our staff, each staff weekly now, and our new sanitarian, Jocelyn's doing a great job. She's out there doing almost every risk-based inspection that we have now. So things are going well. I would leave that. I'm trying to be expeditious on this. Is there any questions? You do see the scores. Another thing I've noticed, and I will tell you that I am very pleased with our staff. You're going to find this a little contentious, but when I see lower scores, especially when we haven't been into them, it really means our staff is doing a really thorough job doing food safety inspections. So I've always encouraged that we're clearly, if we see A+, we either became some cloud-like community or we're not doing our job. So I always tell my staff that don't be afraid to give a score if they deserve it. And I know that some people may not get that, but it's a good thing. From a guy who's been a sanitarian since 1986. You do have the summary of low grades, and we still continue to have some low grades, and we're doing follow-up inspections. It's a pretty good list, but it really has a lot to do with the fact that we really haven't been into a lot of these places, and my staff will be the first to tell you, my gosh, you know, they're not doing as well as they did when we were doing routine inspections. And we do two inspections a year on all risk-based, 3 and 4 risk-based, and, you know, we accelerate inspections. So I'm really very pleased with what we're seeing here. And I know that our work here is going to get these establishments back up into that high performance area. What's that? Yeah,
I did pretty.
but there's a lot of C pluses and Cs and so. And then there's one we had to address with piggyback. I think that's a good, Roger, on environmental health, unless there's questions.
No, that looks good. I mean, see where there'd be some lax operations that needed to get back up to speed. Yeah, overall, that's pretty good.
All right, so Fulani should be coming to visit us pretty soon, and she'll be doing the community health report. And I'm going to try one more time to get.
Jessica, did you have a question?
I just had a logistical question. Are these posted anywhere in the restaurant? I know sometimes I go in and see them and sometimes I don't see them. So is that
Supposed to be.
they're supposed to be visible? Okay. just
Yes,
my own
so
personal-
there's actually, the board has actually developed a policy on how those are supposed to be.
Okay.
Even to the point where on the inspection report, it's not conspicuously posted, it's marked as a violation. So I think when we started the grades system, we put a lot of policies in place, and you probably haven't had an opportunity to see those, but we'll get those policies. I've talked to a few about finding all the policies, putting them in a book, so all the board folks have those policies. So we'll work on that. It's been discussed. So maybe I can get here now.
Volunteer fill in inspection. That's very important.
If I can do anything else.
You want a minute? Yeah.
Well,
Got it.
So, but when I went to click the link. Okay. I should, right? Oh, she's online, Kalani? There she is.
I've been out in the hall.
Oh, I'm sorry. So,
Everyone, hi there.
so this is our new community health director, and I asked Kalani to come and meet everyone in person. So,
Welcome. Thank you.
so Kalani will be doing our community health report.
So first off, I do want to give a big kudos to our early childhood teams down in community health with and our Flathead Teachers Home Visiting Program, as they received the 2020 Early Childhood Champion Award from the Flathead Best Beginnings Community Council, which was awesome, and they got recognized in February for that. So I'm kind of, this is my first time here, I'm jumping back a couple months, that's okay. If anyone wants more information on that, the Flathead Best Beginnings website has some info that they presented on us, and it also has a link if you guys wanted to watch the award ceremony. It's very good for that. A couple things about, I'll just jump into our report real fast. Immunizations, our numbers have been low, but keep in mind that we have very service hours since all of our nursing staff has been designated to the COVID testing clinic. But we do have plans to continue expanding our hours. So over March, we did a little expansion. April, this month, we are extending a little bit more. And then May, we do have plans to have Monday and Friday be full days available for appointments as well as Thursday afternoons. So those are my immunizations. We were able to do the annual KPD lead testing, which was great because that did take about 3 days in March to get done for those officers. We did about 45 of them. So I was glad that we were able to do that. Our WIC numbers have stayed pretty steady, about 1,000, which is pretty good given that all of our services are still just via telephone, telehealth services for our WIC participants. We don't have any people in our office. And our numbers for no-shows have been pretty good since we have been doing those services. I think they fit in with our clientele a lot easier to manage for them to pop on a quick 15-30-minute visit. So that's been pretty good, steady. We did have our state monitor in January for the WIC team, and they did receive a tier 1 designation, which is the highest rank that you could get. So very good work on their behalf there. Our home visiting numbers in March went back up to 99% for our caseload, which is great. We were down a little bit in January and February due to new staff onboarding. And with them taking on caseloads, we were able to reduce our wait list, which we had for our referrals, which was about mid-30s, about 34 that we had, and we were able to reduce that all the way down to 0 in March. So we're able to enroll quite a few families, and everyone's caseloads look pretty good. We have participated in some group connections for home visiting. We did the United Way Winter Warm-Up, which was an outdoor event, as well as we partnered with the Nurturing Center to do an outdoor biking event just in March. So that was pretty fun. And the home visiting staff is trying to resume in-person home visits again, which was a pretty big need. People were getting pretty fatigued and burnt out with the telehealth phone call visits for our home visiting parents and teachers program. So we do a little bit of a COVID screening questionnaire, and it's strictly per comfort level of the family and the home visitor to allow them to do those visits. And most of our families have actually opted in for those home visits, which has been excellent for rebooting rapport and everything with our families. Those are my main updates. Do you guys have any questions for me?
Can you tell me, with the police officers screening, I'm really interested in that, with the, did you have any community officers test positive for high lead exposure? And no, okay. Right.
So Roger, if you don't mind, Kalani's taken a real directive to try to get back to some normalcy with other vaccinations. And those that know me know that's really important that we get back to providing those other vaccinations. And also to really, we're trying to figure out how we're going to do travel vaccines. So as people start to travel more, we really need to step up and start to conduct travel vaccines. So trying to identify an advanced practitioner and our own and Kalani staff that can work in concert to get back into the travel vaccines.
And we have some meetings to kind of pick the brains of some other health departments like Missoula City County Health Department. We're going to meet with them on Friday to kind of get some tips and pointers on how they roll out their travel program to kind of influence our redevelopment of ours. Any questions?
Dr.
I was going to ask it later, but we're talking about vaccinations. When do you anticipate incorporating COVID vaccinations into your vaccination program that we already have? That's the big, and the related one is how do we get the rest of the people vaccinated for COVID? That's the big elephant in this room.
So Roger, if you don't mind, just real quickly. So right now we're compressing from 3 days to 2 days. We're starting that move to compress to Tuesday, Wednesday deliveries. There are clinics out there that are starting to do, we act like a doctor's clinic when it comes to doing vaccines in-house. It takes more time. Why we set up and do what we do.
Oh, yeah, and it gets rave reviews and it's deserving, but at some point.
At some point, we're going to have to.
And this body should know what you're anticipating.
Yeah.
You either say, yay, continue it, or
we're going to
think about changing directions.
First step is gonna be the 2-day plan, 2 days a week clinic. When we start to really see those numbers go down, we're gonna regroup again. We're gonna get out of the trade center or the expo building.
How
We
many
know,
we down to about now per day?
well, yesterday we're
Mid
6,
600.
yeah, and the day before we were 5 something. Today we're supposed to be 5 something.
So they're big numbers, they're still big.
They're
numbers,
still big numbers, you know,
But it's
we're
really
doing,
slowing down.
yeah. But we are working very deliberately on trying to compress.
Mhm.
And then we're gonna have to see how we're gonna start to deliver. At some point, we will. The biggest challenge we're gonna have is they're not single dose vials. You know, you have to draw 6 doses, which you either set that up in advance. There's still gonna be some challenges for that, but we're trying to work through all of that.
The clinicians should be asking the question, what are we doing to incent people to get in now until November it stops and it's done?
I get
What's
your
our
point.
communication plan?
Now,
Every patient I see, Bill.
What's that?
And every patient I see.
Well, everybody I see, have you been shot?
yeah, the biggest challenge is there's Glacier Medical's doing some clinic-based immunizations now. Not a lot have, and I think they're letting the pharmacies, you know, because they're a little bit more of a hybrid. They're letting the pharmacies get out ahead of this, and at some point, this is going to be a clinic-based vaccination. The biggest challenge is going to be it's a multi-dose vial.
Have you run into any access problems with people that say that work bankers hours and don't have access to leave work for a reason?
We're actually trying to address that now on our form. We have heard that there might be some folks that just can't get there before 5. So we're thinking of very soon taking our clinic and moving it afternoon, evening. Yeah, Jessica, that gets slapped in our face several times. You know, it's easy for us to just go 8 to 5 and see ya. And we know that there's some challenges with schedules, but that's a great point.
Nice to meet everyone.
Yeah.
Nice to
Thank
meet you.
Keep up the good work.
Population health.
Population, Jen Gronkowski, right there.
I'm Jennifer Rankowski, I'm the population health manager. I don't think I've met. Hi. So for our programs, we're doing pretty good considering that almost 95% of the group are in COVID at the vaccination clinics and everything. Cancer screening program is going well. I think we'll meet our goal this year, which is great, and the state's very happy. They actually have given us 10 more, even though we had asked for less. Because we actually have, for our goal for Montana cancer screening, we actually have 160 more than any place else in the state. That includes Yellowstone. So we have, our numbers are doing really well. Malia had somebody working with her this year, and he's been doing the tobacco outreach to the schools and been getting out there. And then Malia has also been working with suicide prevention. And so has Lauren. We are phasing Lauren back into the mental and behavioral health things. So we're excited that she's going to be able to phase back into that. Lauren England has been working diligently with disease. I don't know if you guys have any questions on those. I asked her just about some of the little things that came up. If there was anything, I should be able to answer those questions. If not, I can take it back to Lauren with communicable disease. But she's been doing a great job keeping up with the STIs and communicable diseases in the community. So she hasn't really touched COVID that much. So that's been really good that we've kept her separated. She's helped a little bit at the clinics, but been mainly in CD world. Any questions on those?
I'm not even going to remember the grant name, but I wonder if the board would like to hear about our
There's like 6 grants.
no, the one that we just.
Oh, Lawrence, the behavioral health.
Yeah, but.
Yeah, no, I can bring, Lauren could do a presentation and tell them about it. So we did just do the commissioners just approved, to do a
Right along,
huh?
right along.
Mental health crisis.
Yes, a ride along with the support of, Sheriff Pino and, Chief Overman. So, that funding is gonna come through, so they're going to be a co-responder, for mental health crises when they go out there. So Lauren's helping that, and both of the law enforcement agencies that supported it are pretty excited about having that. Feel like it can be a great help for the community and their responses, because that's what they're seeing a lot of is the mental health.
Is that additional person than the person that's already doing it?
It's the continued.
It's good, it's a continuation of, so there's one
We
position.
started it a year ago, I think,
Yeah.
and
Yeah.
we're just continuing
Yeah,
on.
we're
and I think
continuing.
we're
We're
gonna
gonna
add
get
another one.
funding.
Yeah, I was gonna say, is there funding for a second
So,
position?
so there's actually, we have some funding in our budget, but the funding goes through the Western Montana Mental Health.
Right.
And they're the ones that are hiring the co-responders, or whatever we call them.
But we're funding a second position?
There is a second position.
There is a second position.
Yes,
Right,
yes.
right,
Yes.
fantastic.
So I mean, from everything that's happening on the national level, to think that Montana is really doing something proactive, I think you really want to see what this program can do.
No, and I, excuse me, I agree. I mean, part of it is the city as part of that funding for the second position, so really do appreciate that program. I had a question regarding some of the health grants that we had. I mean, for the last couple of years, we've done some mapping for homelessness, but then also for suicide prevention. Do we have plans for where we're going with next steps for sort of those community mappings that we were doing?
Nope, but I can find out. That was not, that was under Holly, I believe.
Yeah, no, sorry about that.
So, I can look into it, but it might be falling under the community, health assessment,
Which,
which we're working on. And Molly, once she gets back from maternity leave, will be working with that. So,
Just speaking from experience, that I know that was really appreciated by agency, and also something that was sort of alongside with the co-responder, just really helpful information so that we knew how the co-responder could be utilized and how to connect them with services to do warm pass-offs.
yeah, and we're gonna be enhancing our connect as well. So that's in the works.
All right, any other questions for Jen?
Thanks, Jim. Thank you very much. Nice meeting you.
Like we're on to Kirk, huh?
Good afternoon. And this is the finance report for March 1st through March 31st. I'll get started quicker. So cash balance still looks good for the end of March at 1.2 million. Immunization clinic, environmental health, just steady previous months, just like this month. So been very consistent. But environmental health doing really well for revenue growth. The capital improvement program, the mosquito department had an Argo all-terrain vehicle that broke down. And so looking to have that replaced with a side-by-side, estimating about $18,000 to replace that. And we do have the money in the CIP fund, so not a problem there. Home health, we had some good news. They've been working on the software for the reimbursements, ironing out some of the issues. Got in some additional receivables, brought in the cash. Balance about 102,000, up from that previous month of about 50 or so, so looking better. And Courtney sent me an update today. The AR at about 317,000, so we actually collected a little bit more from the numbers here on court. The finance committee met a little earlier today and was updated on the preliminary budget. The budget
was approved in committee, and we'll go ahead and bring that budget to the board, the preliminary budget here in a couple weeks. So, and everybody should have most packet with the most recent preliminary budget. So let's take a look at that. And do you have any questions?
Looks good. Thank you, Kurt.
Okay.
Thank you very much.
Okay, on to your health officer's report.
Try not to go through things that have already been said. So new cases in April, you can see the graph is actually trending up a little bit. Interesting that we had such a nice start to the month. We had low cases. So our cases over the last few weeks have probably been averaging, about 13, 14. The monthly average is very similar to March, but we are seeing the trend upwards, and we have also seen a trend upwards in hospitalizations. Interesting along this, though, is the AOA director had asked me to, and I can do this, and it's terrible work, but had asked me how many people over 65 years old have been vaccinated. So I started through all of the state data. We have, it's about 40,000, 45,000 entries long, right? So I was able to sort it and look, and the vaccine uptake in that population is about 65%. So not bad. It's not great, but it's, so when you start to think about our cases and hospitalizations, I don't like to give the guy a lot of credit, I'm just kidding. But Gianforte did the right thing when he shifted to susceptible populations instead of occupations. So when he started 70 and over, that tier 1B, then went 1B plus 60 and over, we were able to target some of these populations that are high risk for hospitalization. So I really think that that's had a benefit to the program. If you go to the clinics now, though, you're seeing a lot of young people. But it's funny, you still see 80-year-olds coming in, wondering, why did you wait so long? But I really like this other chart here. When you look at positivity rate versus total tests, and you see that our positivity rate's been under 5 for several weeks. Our total tests are up. Now, if you just think of it from a mathematics perspective, the preliminary data for last week showed our positivity rate climbed to 5.5%, but they hadn't put all the data in. So if when your denominator shrinks and everything else stayed the same, your rates go up, right? So I'm hoping that's some of the problem right now, that they just haven't put all of the total tests in for last week. But our positivity rate did climb over 5. 10% is a big trigger for us in Flathead County, because that changes how long-term care facilities can do business. They have to test their staff all the time. It changes things a lot. But back to this whole uptake in the elderly population, we haven't had a long-term care COVID case for 4 weeks. We haven't had, every long-term care facility's out of quarantine status. That's your comment earlier, Annie, about people not being able to see their loved ones. This is a good thing. The restrictions are off right now, except we do have a couple long-term cares that are battling a little norovirus finally. We're finally seeing some of them, but these are good landmarks because people can go visit, and it's really kind of nice to see. And the long-term care, the vaccine uptake in long-term care residents, 80%. That's a great number. So the care is a lot lower, but the care, those under care, the vaccine uptake is 80%. So this is why I think we're seeing some real positive affect in our community right now. So just to move on, this is doses given as of the 16th. We're over 40,000 total doses given between KRH, the health department, and North Valley Hospital. If you just kind of look at this, if we stop tomorrow, our vaccine uptake in the general population would be, this is just us, this doesn't include everyone else out there, would be about 30%. And, you know, if anyone's heard, I'd love to see 40% in Flathead County. I think that would be a good number. And maybe over time we'll make that. I'd love to see 60%, but I'm a realist.
Yeah. Is there any way, can we get the numbers from the pharmacies and
Yes.
other entities that are they in here? Or-
They're not in there.
I
That's
didn't
why
think
I
they were,
always,
so
I
can
always
we get-
caveat it that this is just the three organizations.
Right,
Now, when I gave you the other number, the 65%, I am looking at everyone.
okay.
So I can see all of the pharmacies, I can see all of the clinics, I can see Flathead County residents that got vaccinated in Deer Lodge.
Oh,
I don't count them because if they're not coming back because they're in Deer Lodge, I don't count them.
yeah.
So,
I might, and they're coming back.
Depends on their address.
Not sure any of those anyway. Bill?
Anecdotally, when I learned the pharmacies were inoculating in the pharmacies, which is Safeway and Walgreens. And I talked to the pharmacist, said, are you doing a lot of them? I said, we're full every day. And what do you average? 30 a day. 900 a month. There's more than one pharmacy. There's two for Walgreens. And I don't know if they do it in every Safeway, but we're talking about 5,000 or 6,000 people that are not in these counts.
right.
As of yesterday, there were 11,000 people that identified having had the virus. Some of those passed away, about 100. 11,500 people that had the virus already. Add that to this people, they now have natural immunity. Because they had, well, I'm not picking on anybody. I know somebody in the room that had it. And has natural immunity. So the actual numbers here, we're gonna add close to 20,000 to that number.
Yeah.
And so it's up in 55% of the whole county right now.
Bill, there are a lot of people who had illness and who've gotten vaccinated after illness.
And they have had the vaccine too?
Correct.
Oh,
Yeah. So
That's the
that's,
recommendation.
Yeah.
There is some doubling up.
yeah, so it's not 100%, those two, it's not 100% additive. There is some crossover there.
But the only thing I'd add is we also don't know, all the cases are actually lab identified positive cases.
Mhm.
We don't know. So it's going to be interesting to see when we really start to see our numbers wane and if that's going to have a big impact on it. So, you know, I think we're plugging along. Yesterday, we had 75 new forms filled out. So there's still a demand out there for our services. The other thing I'd mention is Walgreens is doing vaccine, but they're not doing the 3-week interval. They're actually increased that to 6 weeks. So if we've had a lot of Walgreens first doses, they'll come in and we'll do their second doses. And we encourage them to do that. If they want to stay on schedule, we'll do. We have the vaccine. Second doses don't really cause a lot of confusion for us because it's like one and done, right? So we don't have to worry about people that have the Johnson. They never have to come back. So we don't have to do all the accounting for it, you know, scheduling and everything else. So I think we're going to continue to plug along. I will keep you updated on how we have to reconfigure based on the demand. But we've really been considering.
The herd immunity threshold of vaccines, isn't it supposed to be like 85%? So I mean, we're not, I mean.
Annie, I don't think it's going to be that.
Yeah, I mean, it's not gonna be, but isn't that what y'all believe in? That it should be 85%?
I've told my staff that, you know, if I used to do a really cool little herd immunity thing for the high schools, so they understood why, you know, why immunity really helps. So you can, if you have 90% immunity, right? And you put one person in there with disease and you made them go around and this is bad for, I love this drill, but it's really bad for high schoolers. And you say, when the music stops, touch the person that's closest to you, right? And so if the one diseased person, they can only touch someone that's not. So there's just a little percentage that you might transmit it, right? Well, if they're 50% immune, you still have some chance that you're not gonna have that transmission, whether it be, so at some point, our numbers from an epidemic, they're gonna go down. But it's not gonna be like smallpox and ring vaccination where they're gonna go away. You know, and everyone will tell you, especially with coronavirus, you're probably not gonna ever see it go away. But I think we're gonna see a significantly reduced number as our immunity climbs in the community, even if we never meet herd immunity. That's my opinion. That's no more than my opinion about how I see this disease progressing.
I mean, talking about demand, the other potential things that may affect demand going forward are influx of seasonal employees. I mean, if seasonal employees, you can imagine they want to demand, that may adjust some demand given their unique situation. And then if ages of vaccine get expanded, I know they're looking at Pfizer potentially dropping that down, right? If that ends up going through, that may affect.
I think so. And we're seeing a lot of folks come in that are right now in that 16 to 18-year-old range. And, you know, I'm sure they'll continue to trickle in. But yeah, when they go 12 to 15, we'll see another surge.
You know, back to Bill's point, Bill made a point, I think a good point. I mean, people that have had it, you know, that tested positive, they should be immune to it. And the concept that pharmaceutical companies can do a better job than our natural immune system is a bit questionable. I think a lot of people in the community question that. We were talking about emergency use, non-FDA approved experimental vaccines, basically, that work better than our immune system. And a lot of people are questioning that that makes any sense whatsoever.
Yeah, the only thing I'd mention to that point is the only reason that, you know, that there's a higher level of expertise than certainly mine to say, get your dose, is because so those that have had, we have a little different antigenic response. That M protein seems to be more prevalent in those that have had severe COVID. So one of the recommendations is if you get the vaccine, then you're getting that S antigen, which seems to be a little better of a target. Now, there's some stuff out there that states that, and that's one of the reasons why they do recommend that.
Based on models, based on.
But, you know, I understand your medical model as it deals with chickenpox and measles and everything else. This is a little different creature, at least people say that. But I do understand your point. There are points out there that say, you know, may not be getting the same antigenic response between this vaccine.
But we do need the trust, and they're finding it funny.
Yeah,
Irrational.
and you know, I guess, and not to invoke any, I just, when I go to the clinic, you know, Annie, there's no one there that says I have to be here. My favorite one was I asked a 48-year-old male. I was walking out the other day and I said, why'd you get vaccinated? He looked at me and said, because my wife told me to.
And a lot of people are
That's-
coerced.
That's the
But they're still
coercion,
all voluntarily being there, so it's a skewed population, obviously.
and that's fine. We don't care. If they want to be vaccinated, we want to vaccinate them. If they don't, we don't care. We have to take that approach.
We do care, I mean, we still encourage people to do
No,
that.
yeah.
I mean, we still,
But I can't.
the more
coerce.
people we can encourage, there's a difference between encouraging and coercing. I think employers should encourage their employees to get vaccinated, but encouragement is different than coercion.
Thank you for the clarification, because I don't feel like we're coercive, but we do encourage. You know that. That's what I do.
Absolutely.
It was the wife that coerced. We're seeing a lot of it.
So
That's not illegal.
maybe,
Happens all the
just-
time, yeah.
I'll quickly run through
Okay.
House Bill 121, which I have identified before, was signed by the governor last Friday. It will impact local health. I do want to, as I said right at the end, I want to wait to see what else passes. Senate Bill 108's out there, and also House Bill 257. We've been told the governor's going to veto both of those bills, but we want to make sure that that happens. After that, I would like to have a work session with the board to kind of walk through the ramifications of this bill. I'm optimistic it's. So I'll leave it at that for now. I did provide you my testimony on 199, which literally will probably pass. And just real quickly, we had a meeting yesterday, 2 days ago, with the county and the Board of Health's attorney that I had worked with, Todd Hammer and Marcel, in the past. We had a good, productive meeting. Of the 4 people that were in there, Mike Pence, myself, and the 2 attorneys, I probably felt the worst about the meeting. Everyone else kind of walked out saying, boy, this was good. And I'm going, no, I wanted everything resolved today. Well, it didn't happen. The reason why we pulled my MOU that we were going to take action on is I think we finally have some resolution on the agreement that's in place and what needs to happen moving forward. So there's been some activity between the attorneys the last 2 days. They did ask for that to be pulled back. They did rewrite that MOU, and it has been presented to the attorneys for the health center. So I needed to sit on my hands and just kind of wait for this to transpire. But I think we're moving in the right direction on that. So the next things that have to happen, at least from my perspective, I don't know what's going on out here. I can mute people.
Oh, you can have this. It's okay. You can have that. I thought you were pulling apart a pillow. You can have that.
Now, so just everything's up top. So just so you know, that I'm really predicting maybe a special meeting in 2 weeks. We do need to move forward with getting some of these documents, pre-lease, pre-separation documents going. So just bear with this process. It has come down to the 11th hour, and I will be fine. We're going to get this done, but we need the attorneys to get some stuff resolved. We're also trying to see the Montana Public Employees Retirement System is suing Lewis and Clark County over separation. So we're trying to get some information on the ramifications of the separation on that. It's still not very clear, but just realize there's a lot of other stuff, moving parts going on this. And I think that's why the attorneys want to really tread lightly into here. But our MOU's been modified. It's already to the other party. That's good. The notice of separation MOU document, we're working out those between the parties. And the lease is actually the useful part. At the end of the day, the lease is going to be the useful part. So we've identified the space. We've had an architect that's clearly identified all the space the health center is using. So we're moving forward. Like I said, I'm a little impatient at times, and I really did want everything to be resolved 2 days ago. It didn't happen. So there. Any questions about that? Please bear with us. We'll probably have to have a special meeting.
I just have one question there, Joe. And I mean, it's more just an observation. I get a little bit concerned when everybody else is lawyering up and I'm not, because that usually gets me a little bit nervous. And I just wanted to note that, I mean, we're sharing a lawyer with the county. Is that correct? I mean, it's the health department sharing with the county on having a lawyer. Is that
Yes.
correct? And I just wanted to just flag that for the other board members. Again, this is actually one of those things where we have 3 entities making a decision: the health center, the health department, and the county. as long as we're comfortable looking at that, I just want to make us bring that out and speak that out, that, we're working with a lot of lawyers, and we personally, the health board does not have a lawyer in this, and I'm fine with that, but it's just definitely, I look forward to seeing this resolved.
Yeah, and Kyle, all I can mention to you is that this law firm has represented the health department in the past, and I have a lot of respect for the lead attorney that's helping us.
That's great. I am a son of a lawyer, but I don't necessarily trust them. So
Son of a legislator too, and you trust
that's true.
them?
I don't really trust them either. So
I know you. All right, so that's my report.
All right, thanks. Any other questions for Joe on the director's report? All right, thank you, Joe. With that, I guess there are the other department reports that were in the board's packet. If there's no questions on those, we'll be glad to have Cliff come back and talk to us about the animal shelter one of these days.
My gosh. Don't release the hound. I hope you heard that, Cliff.
I'm
afraid I did.
All right, any other comments before we adjourn? Well, thank you all for attending. Good meeting, and with that, I'll move to adjourn the meeting.
Perfect.
What do I have to do?
I'll scan these.
Yes, we made the plan.